helping make your life easier. Moms every day.
Hives are raised welts or bumps on the skin, and they can appear suddenly. Dr. Rob Shaleski with Allergy, Asthma and Immunology Associates is here to tell us more about hives today. Nice to see you, Doctor.
Nice to see you too. Thanks for having me today.
So, Dr. Shaleski, tell us a little bit more about hives. Let's get more in depth about them. How do these bumps appear? What are they?
So hives are just like red raised, very itchy lesions. They tend to be kind of welt-like. They can come on suddenly. They can be any part of the body. Some people get them usually on the chest, or some other people get them on their arms, sometimes their face. Sometimes they can even come with a little bit of swelling, like swelling of your eyes or your lips.
So, hives are different than a typical rash?
They are a little bit different than a typical rash, yes. There's a lot of different types of rashes. Sometimes people get rashes from being out in hot weather. Sometimes people get rashes from taking a medication, which is a little bit different type of reaction than an actual hive.
So you would know the difference because hives are going to be bigger, more protruding from the skin, perhaps?
Yep, so they're, by definition, they're raised up from the skin, and they can be fairly small, but just a few millimeters in size, but they can also be very large and kind of blotchy. But the big distinction would be they're raised up off the skin and extremely itchy for people.
And what causes hives?
There's a lot of different things that can cause hives. When I think about hives, I usually think about kind of short-term hives or long-term hives. Now, short-term hives can be caused by a food that you ingest if you're allergic to it, maybe a medication if you're allergic to it, sometimes being stung by a mosquito or a bee or a wasp or another type of stinging insect can cause it, even contact with something that you're allergic to, such as poison ivy.
What can you do to make hives better?
So medications that we usually prescribe for people with seasonal allergies also work for hives. Those would be things like over-the-counter antihistamines like Zyrtec or Claritin or Allegra. We normally, though, prescribe them in a little bit higher doses than we would typically for seasonal allergies, and to try to get those hives under control. There are a few newer medications out that are injectable medications that can kind of pinpoint the specific process that hives will kind of go through when they develop, and they've worked pretty darn well for people.
Okay, Dr. Shaleski, thank you for telling us about hives today.
You're welcome.
And for more information on Allergy, Asthma, and Immunology Associates, visit 1011now.com/momseveryday/